Hello, everyone. My name is Summer Lykins, and I'm a rising senior studying anthropology and environmental studies at Center College. During my time with the Summer Public Health Scholars Program, I worked alongside Professor April McCoy from St. Augustine's University to determine how COVID-19 affected HBCU students' mental and physical health and examine the efficacy of campus interventions. Through this research, I learned about the pandemic's detrimental effects on African Americans in the United States and how important vaccination access is to that community. However, there may be barriers that are affecting vaccination rates within that population. In January of 2020, the United States confirmed its first COVID-19 case. Since then, there have been over 33 million cases, 598,000 deaths, and 2 million hospitalizations. However, these numbers do not show the disparities that African Americans are facing related to the virus. African Americans account for 1.1 times more cases, 2.9 times more hospitalizations, and 2 times more death than white non-Hispanic Americans. Although COVID-19 vaccinations have proven to lower chances of hospitalizations and deaths, only about 32% of the African American population is vaccinated, while 45% of the white population and 62% of the Asian population are vaccinated. Lack of internet access, scheduling burdens, and lack of transportation may influence this outcome. For research purposes, I searched Google Scholar using key terms such as COVID-19, vaccine, and African American for relevant articles that related to my project topics. I also searched Google using similar key terms for gray literature and news articles about interventions and current events associated with my topics. To be considered, articles had to include the study population of African Americans in the United States, connect to the project topics, and be published after 2015 so that information is relevant. Once vaccine rollout began, hospitals and clinics continued using digital platforms for appointment scheduling, which requires internet accessibility. This may be a contributing factor to the current gap in vaccine statistics. A census report revealed that 36.4% of African American households do not have broadband access or a computer in their home. This was the highest percent of races surveyed. A growing body of research explains that cost influences whether homes have connection, but COVID-19 heightened economic instability and left 44% of African American households with a job or wage loss, which may have exacerbated affordability issues. Lack of connections at home may lead to outsourcing free internet use options like public schools or libraries. However, many states enacted stay-at-home orders to reduce the spread of COVID-19, which may have impacted broadband accessibility. COVID-19 revealed the importance of essential workers, and many of these employees worked grueling, packed schedules. Approximately 37.7% of African American workers are employed in essential industries, and working during the pandemic may affect the likelihood of obtaining a vaccine appointment. Furthermore, essential African American employees are less likely to have the ability to work from home, with only 1 in 5 having the possibility to telework, which may tighten schedules and restrict access to appointments. However, even with time off work, essential workers may experience a lack of convenient available appointments because of limited times. Not only do African American employees have to find a date outside of their work schedule for vaccination, but they may also have to consider additional time afterwards because of potential side effects. Although COVID-19 vaccines are safe and effective, some have reported symptoms like fatigue and fever, which may lead to employees feeling unwell and needing additional time off. Vaccinating African American essential workers is a critical task because of the high risk and exposure to COVID-19. Working in essential businesses may lead to increased exposure, especially if the occupational setting is experiencing a lack of social distancing, proper sanitation, and/or personal protective equipment. Some African Americans may struggle with unreliable transportation and navigating distribution centers. Since the pandemic interrupted public transportation and some residents do not own vehicles, communities may have hindered transportation ability. African American families are the least likely to have vehicle access, with families being 30% more likely to not own a vehicle, leaving many people unable to transport themselves to vaccine centers. In some cases, public transportation is more affordable and accessible than personal vehicles. Among urban residents, African Americans account for 34% of public transit passengers. However, some transportation lines temporarily altered services to comply with mandates as health officials advise against their use. Discouraging use and fear of infection may have influenced some citizens' choice about using transit services, leaving them with fewer options for mobility. African Americans may also face longer driving distances to vaccine centers. A study that mapped vaccine sites and their proximity to residents identified 69 counties where African Americans had a higher risk of having a driving distance greater than 1 mile to the closest site, and 94 counties where African Americans had a risk of a driving distance greater than 10 miles. Within those counties, 6.6 million people identify as African American. While public transport may help alleviate some burdens, multiple cities in the study were suburban or rural, which may not have these services. Lack of internet access, scheduling difficulties, and lack of transportation may be impacting vaccination rates in the African American community. Using telehealth platforms for appointments may impact African Americans that do not have broadband access, and shutdown restrictions may have reduced public internet accessibility. Utilizing other forms outside of telehealth could potentially expand access. Many African Americans are essential employees, and their work schedules may affect their ability to get vaccinated. Adding flexible, convenient appointment hours and providing paid time off could lessen that burden. Transportation may also be a factor limiting vaccination. Interrupted public transportation systems, lack of vehicle ownership, and longer driving distances may have hindered transportation capability. Increasing administration facilities and providing convenient transportation to clinics could reduce some of these problems. For helping me get to this point, I would like to sincerely thank Columbia University's Summer Public Health Scholars Program, the Centers for Disease Control and Prevention, Professor April McCoy, TA Francis Rohina, and Center College. Thank you all.